Hi, Jack.
Hi.
Thank you for coming in.
Nice to meet you.
My name is Dr. Matt. How are you feeling?
I'm having some issues with my shoulder.
Okay. Let's go ahead and verify your date of birth first, and we're definitely going to take a look at your shoulder. Can you please tell me your first name and your date of birth?
Jack, and it's January 28th.
Perfect. Okay, so I have the right chart. Did anything change in your medical history?
No, medical history pretty much the same.
And what about your allergies? Are they still the same?
Yeah.
No allergies?
Clear.
Great. Are you taking any medications right now?
No medications.
Okay. So tell me what happened.
Well, I was at work, and as you know, I'm a contractor, so there's a lot of heavy lifting involved. And I was picking up some boxes, and I just felt a sharp pain in my right shoulder.
Okay. And when did this happen?
Yesterday. It occurred yesterday.
Okay. So you were lifting something heavy and you felt a sharp pain in your right shoulder.
Yes.
Are you able to move it at all right now?
Yes, but there's a lot of pain involved when I do that.
Okay. On a scale of 0 to 10, 0 being no pain, 10 being very painful, how would you rate your pain right now?
I would say it's a 6.
Okay. And are you having any other type of pain besides sharp? Do you feel something like inside? And would you describe it in any other way?
No, just sharp pain when I try to move my shoulder or lift up my arm.
Okay. And did you take anything for pain?
Just ibuprofen.
Ibuprofen. Did it seem to work?
It helped a little, but not much.
Okay. Did you try cold packs or heat?
No, I have not tried it.
Okay. Okay, let's go ahead and we're going to take a look at your shoulder, but before that I want to take your vital signs and I'm going to do a quick medical exam, make sure that I'm not missing any other symptoms.
Sounds good.
So I'm just gonna wash my hands. I'm so sorry that you are having that kind of pain. I know that everybody needs to work, so this doesn't allow you to do your job. That's not good. So let's see what we can do to make you feel better and get back to work as soon as possible.
Sounds good.
Okay, so first I'm going to take your temperature. This is just going to go on the forehead. Any flu-like symptoms in the last 2 weeks?
No.
Okay. Very good. Now we're going to measure your heart rate and your oxygenation. I'm going to need just your index finger and you can relax now. And since you're having pain in the right shoulder, we're going to go ahead and take your blood pressure in the left arm. Okay, so let's see. Oxygenation is 98% on room air, so that's good. And heart rate was a little bit elevated, but it could be due to the pain. Okay, so just relax your arm. Good. And your blood pressure is also a little bit elevated, 130/70. I'm a little bit more concerned about your systolic, the 130. And I'm going to listen to your heart. So I'm just going to put the stethoscope right here on your chest. Just going to need you to relax. Take a deep breath in. Good. 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 Okay. Everything sounds normal so far. I'm gonna go ahead and change, listen to your heart with the bell. Now we're looking for murmurs, which could indicate valve abnormalities. So far I'm not hearing any murmurs, any kind of swishing sounds. So that's good. Okay. I was able to hear only S1 and S2, no S3, no S4, so no signs of heart failure. Now I'm going to go ahead and listen to the lungs. So take a deep breath in and exhale. Good. Again, take a deep breath in and exhale. Very good. Now I'm going to listen to the side. So just put your arm like this. Take a deep breath in and exhale. Okay, let's go ahead and switch. I'm going to listen to the right side. I'm so sorry. I'm so sorry. Take a deep breath in and exhale. Now you don't have to move. I'm just going to listen to the back. Take a deep breath in and exhale. 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 Okay, so everything sounds normal. Okay. So blood pressure 130/70. Heart rate was 102, just a tiny bit elevated, nothing to worry about. Respiratory rate was 18, within normal limits. Temperature was 98.5, also normal. And I think that's it. So let's see, S1 and S2, no murmurs. And lung sounds were normal. Okay. Okay, so now I'm going to just look at the shoulder joint. The shoulder joint is one of the most mobile joint in the whole body. So I want to make sure that if there are any outside signs, I'm not missing them. So I'm just looking first for any scratches. And does it hurt if you're just sitting like this? No, only when you move it.
That's correct.
Okay, so I'm just going to move your shirt a little bit. Okay. And now I'm going to palpate. Let me know if it hurts. Okay, it does seem to be a little bit more swollen. Now let's go ahead. We're going to take a look at the other one. And what I'm trying to do is to compare the two joints. This way for sure we know if the right shoulder joint is swollen. Okay. So yeah, definitely the right shoulder is more swollen than the left one. I'm going to test your sensation in the shoulder first. Can you please tell me if you feel this?
Yes.
Okay. What about here?
Yes.
Okay. Do you feel it the same?
Yes, I do.
Okay. What about on this side?
Yes.
Okay. What about here?
Yes.
Okay. And what about here?
Yes.
Good. What about here?
Yes,
Okay. Now I'm going to touch you with a different type of texture. Please let me know if you feel it.
I feel it.
Good.
Yes.
Good.
Yes.
Good.
Yes.
Good. Now please tell me if you feel sharp or dull.
Dull.
Good.
Sharp.
Good.
Dull.
Good.
Sharp.
Good.
Dull.
Good.
Sharp.
Very good. Okay. Okay. Next, we're going to also check the innervation in your shoulder. So what I'm going to do, I'm going to create a vibration and I'm going to put it on the bony prominences of your shoulder. I'm going to need you to tell me if you feel it and when the vibration stops.
Yes, I feel it.
Good. Now please tell me when it stops.
It stopped.
Good.
Yes.
Okay. Now please tell me when it stops.
And it stopped.
Good.
Yes. It stopped.
Okay.
Yes.
Okay.
And it stopped.
Okay.
Yes.
Okay.
It stopped.
Good. Okay. So the innervation in your shoulder seems to be intact, so that's very good. It means that no nerves were damaged when you had the accident. Okay. Next, I'm checking your reflexes. Okay, is that hurting in any way? Good. 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 Okay, now what I would like to do is I would like to take some measurements of your shoulders. Okay. And we're also measuring your clavicle. And your scapula. to mark some points. Don't worry, this will come off. Let's go ahead. We're going to create some range of motion movements, and I'm gonna need to know if you're experiencing any kind of pain. And don't worry, we're gonna go very slowly with this, okay? So first we're going to try what's called flexion. So just let your arm loose and I'm going to move it for you, and then you can do the same thing by yourself if you can do it. Okay, how's that?
Good, but a little painful.
Okay, on a scale of 0 to 10, how bad does it hurt?
2.
Okay, now we're going to try extension, so just leave your arm loose. Okay, how's that?
No pain.
Alright, now we're going to try hyperextension, so we're just going to move your arm in the back. How's that?
Pain, I would say about a 3.
A 3. Okay, now what I need you to do is to do the same thing by yourself and do it until it hurts. Okay, so that's the most that you can do.
Yes.
Okay, now go ahead, put your arm back down. Stop right there. Did that hurt?
No pain when it's down.
Okay, now go ahead and move it back. Hyperextension, that's enough. Okay, and still painful?
Yes, pain is about a 3.
Okay. Now what we're going to do, abduction and adduction. So just let your arm loose and just follow me. Okay? Can you do that? Okay. Is that painful?
A little.
A little. Okay. Let's go 0 to 10. How bad does it hurt?
3.
3. Okay. And now I'm going to put the arm back down. Okay. Go ahead. You do it by yourself.
Now the pain is higher.
Okay.
Feel the pain like a 4 or 5.
Okay. Now go ahead. Put your arm back down. And did that hurt when you did that?
Yes, it did.
Now what we're going to do is we're going to create an internal rotation movement and an external one. So just put your arm like this. Good. Can you keep it like that?
Yes.
Okay. Now put your arm down. Is that painful?
Very painful.
Okay. Now put your arm back up. Is that painful?
Not as painful.
Okay. So I'm suggesting that there is something in here that is damaged. So what it could be the rotator cuff that is inflamed. We could also have some ligaments that are inflamed. That could be the cause of the sharp pain. And it seems to be more in the front than in the back. Now let's go ahead. We're going to check your scapula. And what I need you to do is to create 180 degrees. Okay, put your arm back if you can. If not, okay, good. So the scapula is very mobile, which is good. Okay. We're checking the clavicle now. I want to make sure that The clavicle is not broken. The humerus is not broken, so you don't have any broken bones. With broken bones, you would feel a little bit more pain than what you're feeling right now. But you want to be back in shape, and you want to be able to lift and, to keep working. So, okay. We need to mobilize your arm, that's for sure. I'm gonna need you to be off from work for at least a week, or you could do just office job. That's okay, but just no lifting with this arm for a week. You need to let the tendons and the ligaments to rest, because I think you pulled them, and that's what the pain is from. Okay, so what I'm going to do, I'm going to do some magnetic triggers on the bony prominences of the bones that support your shoulder joint, and that will create a flow of energy towards those points, and we will be able to create a healing process and to fasten the healing process. Okay, I'm going to begin. Now we're going to just massage the whole joint, and this way we'll create a blood flow of energy that will go towards the joint, and we will be able to help your body heal faster. Okay, so first we're just gonna need some gel. Okay. And is that painful in any way?
Yes, pain is about a 3.
Okay. You know what they say, no pain, no gain. Okay. I'm going to put a little bit more gel. So the skin might turn a little bit red, but it will go away in a few days, and there's nothing to be worried of. Okay, so as you can tell, I am pulling everything from your inside of the body to your shoulder joint. I'm trying to trigger the blood flow to go towards that point. Okay, let's go ahead and put your arm like this. I'm just going to slowly palpate. How's the pain?
It's gotten a little bit better.
Okay, that's very good. Any pain here?
Still a little painful.
Okay, yeah, the pain will not go away right away, that's for sure, but you should feel improvement. That's good. Okay, so just like I said, try not to move this arm as much. Immobilize it for 7 days at least. Just going to write down everything that we did. And please continue with ibuprofen every 6 hours, 600 milligrams, I would say. And this will also decrease the inflammation that you're feeling. If it gets any worse, you can go ahead and give me a call. But otherwise, I think the pain will slowly go ahead and heal. And you're not going to feel it that bad in just a few days. Okay, but the good thing is that nothing is broken and it's just a pulled muscle.
Okay.
Awesome. Thank you for coming in.
Thank you very much for the diagnosis.
No problem.